Pregnancy Week 34. At 34 weeks pregnant, you are nearing the final stages of your pregnancy, with just about 6 weeks left until your due date. Your baby is growing rapidly, and your body is preparing for labor and delivery. Your baby can now easily open and close her eyes, blink, and practice focusing. As your baby grows and occupies more space, you may experience discomfort, frequent trips to the bathroom, and even hemorrhoids. With just a few weeks left, you are about to become a mom. Your body and your little one are going through many changes as you prepare for this exciting new chapter. Week 34 Pregnancy Ultrasound. At 34 weeks of pregnancy, expectant mothers typically see their obstetrician every 2 weeks. During these appointments, doctors may perform a biophysical profile, BPP, which includes an ultrasound and a non-stress test to monitor the baby's heart rate. This assessment helps ensure the baby is healthy and responds well to stress. At 34 weeks pregnant, expectant mothers may receive an ultrasound for several reasons. It can act as a growth scan to check if the baby is growing healthy, confirm the placenta's position and health, and assess amniotic fluid levels to rule out conditions like polyhydramnios or oligohydramnios. For women with high-risk pregnancies, due to conditions such as gestational diabetes or preeclampsia, ultrasounds provide essential monitoring. During the ultrasound, parents can often see distinct facial features, including chubby cheeks and open eyes, as well as the baby's movements, such as stretching, yawning, and bringing hands to the mouth. The doctor may also evaluate the baby's lung development and amniotic fluid levels to ensure everything is normal. Parents may opt for 3D or 4D ultrasounds, which are ideally performed between weeks 26 and 34, to obtain more detailed images. Week 34 Size of the baby. At 34 weeks pregnant, the baby is the size of a butternut squash. The average fetus at this stage measures about 17.7 inches in length and weighs between 4.7 and 5 pounds from head to toe. Since growth can vary for each baby during this time, it's normal if your baby's measurements differ slightly from these averages. Week 34 Baby's Development. At 34 weeks of pregnancy, your baby is undergoing significant developments in preparation for life outside the womb. The protective layer of vernix on their skin is thickening, creating a barrier against amniotic fluid and helping to safeguard their skin during delivery. If you are having a boy, his testicles are descending into the scrotum. Your baby now resembles its appearance at birth, although with less body fat, and is experiencing rapid growth, which occurs as limbs fatten and the central nervous system develops. Their fingernails have grown to the tips of their fingers, and their skin is smoothing out as they continue to gain weight. Your baby can hear, see, sleep, and breathe. You might notice increased movements as they sense the impending arrival. It is crucial to ensure adequate calcium intake for bone development. Sleep patterns are changing, with periods of deep sleep and REM sleep, while the lanugo, fine hair covering the body, begins to fade. The adrenal glands increase cortisol production, which signals the lungs to produce surfactant. By this point, most babies are in position for delivery, and those born at 34 weeks typically have developed lungs, allowing them to survive outside the womb with minimal medical assistance. Week 34 Pregnancy Belly. At 34 weeks pregnant, many women may notice that their belly seems lower than before, as the baby has likely dropped into the pelvis. The fundal height, the distance from the pubic bone to the top of the uterus, typically measures between 32 and 36 centimeters. However, factors such as body type, the baby's position, whether this is the first pregnancy, and the amniotic fluid levels can cause variations in this measurement. Amniotic fluid levels peak between weeks 34 and 36, which may make your belly feel less expansive, even though the baby is growing snugly inside. As a result, your baby remains active. Movements may feel more like rolls and stretches rather than sharp kicks due to the reduced space. It's important to keep track of the baby's activity by using kick counts. For expectant mothers of twins, increased restlessness may signal that labor is approaching, as twin pregnancies are often delivered around 36 weeks. You may also feel tightness and stretching in the skin around your belly, which can become itchy, and you might notice the development of stretch marks. A dark vertical line known as the linea nigra may become more pronounced. Your belly button might flatten or pop out due to the stretching of the skin. As your baby's head moves lower, you might experience increased pelvic pressure. Week 34 pregnancy body changes. At 34 weeks of pregnancy, your baby is developing well and has a strong chance of being healthy at birth. You may feel some relief as the baby moves into a head-down position, which can make breathing easier by increasing lung capacity. However, this position also puts more pressure on your bladder, resulting in more frequent trips to the restroom. You may experience that walking is more challenging. The top of your uterus is about 5.5 inches above your belly button. Hormonal changes may cause temporary vision issues, such as blurriness, dryness, and discomfort. These changes are usually short-lived and should resolve after delivery. Fatigue is common at this stage due to discomfort and anxiety about the upcoming birth. You may have gained between 22 and 35 pounds, with the recommended weight gain being about 1 pound per week. However, an increase in activity level can affect your weight gain. If you experience rapid weight gain, it is important to report it to your healthcare provider, as it may signal preeclampsia. Stay alert for signs of preterm labor, which may include mild abdominal cramps, changes in vaginal discharge, a persistent dull backache, frequent contractions, or your water breaking. If you are pregnant with twins, be cautious, as the risk of preterm labor is higher with multiples. It's normal to feel excitement and anxiety as you prepare for your baby's arrival. Keep your healthcare provider informed about any concerns you may have, and try to avoid last-minute preparations, as babies often arrive on their schedule. Week 34 pregnancy symptoms. 1. Constipation. Hormonal shifts and pressure from the growing uterus can slow down digestion, leading to uncomfortable constipation. 2. Hemorrhoids. The added pressure from the uterus and changes in blood flow may contribute to swollen veins in the rectal area, causing discomfort. 3. Swollen ankles and feet. Fluid retention is common during pregnancy, and many women notice their ankles and feet swelling, especially as the day progresses. 4. Insomnia. Sleep disturbances or difficulties falling asleep can arise, often due to physical discomfort or anxiety about the upcoming arrival. 5. Braxton Hicks contractions. Often called practice contractions, these can occur as the body prepares for labor. They are usually irregular and not painful. 6. Bloating and gas. Increased progesterone levels can lead to slower digestion, resulting in feelings of bloating and gas. 7. Increased vaginal discharge. A surge in hormone levels can lead to more noticeable vaginal discharge, which is typically clear or milky and not a cause for concern. Week 34 pregnancy checklist. 1. Consider a postpartum doula. Consider hiring a postpartum doula for support as you transition into motherhood. They can assist with baby care and meal preparation. 2. Choose a pediatrician. Research and select one that aligns with your parenting values and can support your newborn's needs. 3. Arrange childcare. Consider childcare options for older children during labor to ensure reliable support and ease worries. 4. Try a perineal massage. Incorporate a perineal massage to help prepare for labor and potentially reduce tearing. 5. Learn what to expect if baby is breech. Understanding the options and outcomes for a breech baby can help you feel more prepared and alleviate concerns. 6. Write baby shower thank you notes. Show gratitude by sending heartfelt notes to attendees who gifted you presents. Week 34 pregnancy tips. 1. Limit sodium intake. Reducing salt can help maintain healthy blood pressure and reduce swelling during pregnancy. Use fresh ingredients and herbs for flavor instead. 2. Prioritize breakfast. Fuel your body with a healthy breakfast daily to boost your energy in the final weeks of pregnancy. 3. Prioritize comfort. Listen to your body and alleviate discomfort with supportive pillows or comfortable clothing that allows for easy movement. 4. Room sharing with your newborn. Consider the benefits and safety guidelines of room sharing, as it can be a great family bonding experience. 5. Practice pelvic tilts. This gentle exercise helps reduce back pain, strengthens your core, and promotes optimal baby positioning. For more videos like this, please like, share, and subscribe.